The purpose of this segment is to discuss how to mobilize a patient without using one of the lifts. So if you are looking for more detailed instruction on mobility training, we have a video that exists on the Sibley intranet. But for this segment, we're going to focus on two tools that we use to assist patients to promote patient and staff safety and to give the patient more feeling of security. The first tool we're going to talk about is a gait belt. This is a plastic gait belt. This is the kind that the staff we use on the floors. This is a nice option because you can wipe it down with the Sani wipes between patient uses. This gait belt is a cloth gait belt. You can get one of these in med supply, and these are nice because you can issue them to the patient. They're for single patient use. It can go home with the patient, so you can train the caregiver on how to use this as well. The second item we want to talk about is the walker. So we're going to place a walker in front of a patient if we're going to have them stand up. So the first thing you want to do is test the patient's strength just to make sure that they are going to be safe to stand up. And what I'm going to ask the patient to do is just to kick your leg out straight for me, please, and just to hold it for a count of 5. Okay, that's good. And then if you could kick your other leg out as well, and again, just to hold that for a count of 5. And that lets you know the patient has enough strength, they will be able to safely assist you with the transfer. The next thing you're going to do is you're going to take your gait belt and you're going to place it around the patient. You'll have the patient just slide forward, just bend forward slightly, and I'm going to place it around her waist. You want to make it snug, but not really tight. You don't want it to be restrictive to the patient. The next thing you'll have your patient do is to scoot to the edge of the chair. So you can just scoot forward. It's much easier to stand up if you're closer to the edge of the chair. You also want to make sure you're cueing your patient at all times. A, so they can help you as much as they're able to, and B, so they know what you're doing so they have a better and more secure feeling. So what I'm going to have you do is you're going to keep your hands on the chair, and I want you actually to get ready to push. I want you, when we go to stand up, I'll count to 3. I want you to push as much as you can with both your hands and your legs, and we're going to stand up. Once you're standing, you'll hold on to the walker. I'm going to place my hands on the gait belt so that if she were to lose her balance, I have something to assist her with. One hand in back, one in front. And on the count of 3, we're going to stand up. 1, 2, and 3. And we'll just stand up nice and straight. And that's it.